Welcome to Healing with Her, the podcast where women in medicine share bold and honest conversations from the front lines of healthcare. Step into the world of Black women medical professionals as they unpack the power of healing, the weight of care, and the beauty of showing up whole.
Welcome to Healing with Her, the podcast where women in medicine share bold, honest, and healing conversations from the front lines of healthcare. I'm your host, Dr. Brianne Wilson, podiatrist, and I'm thrilled that you're here. Whether you're a healthcare professional, someone passionate about wellness, or someone who's looking to gain more knowledge about your own health and well-being, you'll find stories here that resonate, educate, and inspire. This podcast was born from a shared truth. Healing isn't just about medicine. It's about connection, listening, and leadership. And who better to lead these conversations than women physicians? We do have our disclaimer, though. The information shared on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare provider with any questions you may have regarding your health. The views expressed by the hosts and guests are all their own and do not necessarily reflect those of their institutions or their employers. At this time, I will introduce our other two guests at this time, starting with Dr. Wooten.
Hello, my name is Dr. Kimberly Wooten, and I am a head and neck surgical oncologist.
And I'm Dr. Melissa Neal, and I'm an ophthalmologist and aesthetic physician.
So I'm so glad that you ladies are here today. Today, our subject is real talk, mental health for the Black community. And so some talking points that we want to discuss: acknowledge the historical and ongoing stigma around mental health in the Black community. We want to highlight the unique stressors, racism, generational trauma, economic disparity, and access to care. Emphasize that mental health is just as important as physical health. And now I want to introduce our guest today, Melissa Archer. Thank you for being here.
Thank you for having me.
So Melissa Archer has an extensive bio, and I'm going to do my best to get everything in that she has done, but I'm sure I have not even touched the surface. So Melissa Archer has been in healthcare and the community for over 20 years, experience in the Buffalo community. She is the co-founder of Black Women's Wellness Village. She has a deep commitment to health and wellness of individuals, families, and communities. She's a fierce supporter of self-care and coping strategies to bring down the temperature of our everyday struggle to live and thrive. Her practice in and out of the office is helping others to find the best version of themselves every day. She works at the New York State Office of Mental Health and is in private practice at Senses Medical Wellness. She's a graduate of DeAuxville University, holding a master's in psychiatric mental health nurse practitioner. She has her Bachelor of Science in Nursing at Damon University and Associates of Applied Science in Nursing from Trocare. She received the Black Achievers Award in 2023, recently awarded the Distinguished Trocare Alumni Award and the NAACP Presidential Award. She's a governance chair of Sigma Theta Tau, an International Honor Nursing Society, board member of Mental Health Advocates of Western New York and Crisis Services, Open Buffalo Emerging Leader graduate. In addition, she was the vice president of the Buffalo chapter of Girlfriends. Melissa was born, raised, and lives in Buffalo. She's a proud wife of Dr. Fred Archer III, who is an amazing pediatrician, by the way, mother of 3 wonderful children, grand fur mother of 9 wonderful fur babies. Again, we are so happy to have her here. And so one of the first questions I want to ask is, so you started out in primary care in nursing, and you have made the switch to mental health. Kind of give us a talk about like your journey.
Yes. So I started out, my first job was at Children's Hospital, and I was a brand new nurse. And I love children's, I love families, I love communities. And, but it wasn't enough, and I started working with adults as well. But it was like, what we're doing is kind of fixing the physical body, but no one was really looking at the mental health individuals. So, in nursing, you can do so many different types of specialties. So, you work in the ER, you work in the NICU, you work in all these different places, and you see the same people coming back with the same things. And it really wasn't, the origin was really not something physical. It was mental and psychological, and nobody was really touching it. And it's not that they couldn't, it's just that just wasn't the specialty. And you can do a psych consult, but you don't follow it up to find out, did this person really get linked in the community? So when I decided to go back to school, I actually was a nurse educator for a nursing home. And I just saw it, not just in, they call them residents in a nursing home because that's where they live, but I saw it in the employees. And it was like, they're coming to work and excellent human beings, but they were not able to work because they brought all their trauma and drama to work. And if they got triggered if a patient said something or another coworker, or they're just having a bad day, that was not going to be a good day for anybody. And so then they end up getting fired or they quit because they may have lashed out and maybe hit someone, or they're talking unprofessionally to somebody. So it's just a matter of like, these are still human beings and they're hurting. How can I be a change agent to help with that? So initially I was studying for my MCATs. I was like, I'm gonna go to medical school and do it. Then I was like, I love being a nurse practitioner and give all the respect to MDs because I'm like, 8 years, I did not have 4 years of med school and 4 years of residency for psychiatry. I said, no. So, and I didn't even know nurse practitioners was a thing. And then I met a psychiatric nurse practitioner and I was like, oh, I can do this. And so went to Duville University. At the time it was Duville College, Duville University, and I have not looked back. And the only thing I wish I did it a little bit sooner. But I'm glad that I've gone through so many phases and done so many different things so that, I can see so many different aspects of a human being, from community, from just so many different aspects. So whatever comes through the door, I'm just like, let's do it.
Mm-hmm. Mm-hmm. I love that. And number one, I love that, it's never too late to go and to do what you want to be able to do. So we just kind of break down into it, right? So one of the things is breaking down the stigma. So first of all, it should be noted that mental health is not a weakness.
No.
Right? So let's address some common misconceptions, right? Mm-hmm. Especially in the Black community.
In our communities, yes.
Pray it away or just be strong.
Yeah. So pray it away. Now, there's nothing wrong with praying. Because when you think about self-care, a lot of people, prayer and spiritual activities is self-care for them. That helps them, like I said, bring down the temperature of the everyday grind. But I've had so many discussions with pastors and if somebody's coming to your church and your congregant they come in with a black eye, or they were coming in and all of a sudden they're not coming in, or when they come in now they're disheveled, they're not making eye contact, something's going on. So yes, we can pray with them, but then you also have to, because that needs to be fed, that side of our humanity needs to be fed as well. But then you also need to refer them, link them with professionals that have gone to school, taken board certifications, that know what to do, and whether it's therapy. I think not just medication, because sometimes people think, just medication and that's it. You have to start off with therapy. And if the therapy is not working with the tools and the strategies, then there's nothing wrong with taking some medication. We take medication, we have a headache. Right. If I have an infection of, strep throat or something, I'm going to take the antibiotics. So there's nothing wrong with taking, if I have severe anxiety, there's nothing wrong with taking Xanax. If I'm depressed, there's nothing wrong with taking Zoloft or Prestige. There's nothing wrong with it. The stigmas that are wrapped around it, I think, are deliberately done as a barrier so that we don't seek out help, particularly in our community. And it's like, let's break that down. Because mentally and emotionally, if you are not in a safe, healthy space, and you'll see that with certain celebrities and things like that, no matter how much money you have, if you are not in a good space, nothing else matters. Nothing else matters.
So this is a question that I want to pose to everyone. Why do we think it's still so taboo to talk about mental health or to seek help in Black households? Dr. Neal, what do you think?
Well, I mean, it's kind of like where I grew up. It's kind of like being strong, separation, that's them, not us. Do you know what I mean? Okay. And I think when you start to accept that, no, I'm just as human, I need just as much support, I think a lot of people don't like to talk about that. I also think sometimes, a lot of households are more focused on the day-to-day. How am I going to eat? How am I going to, that really, if you start to think about that other stuff, they feel that they might lose that ability to do all those other things that they need to do. So that's what I kind of feel. Yeah.
What do you think, Dr. Wu?
I'd have to echo that. I think when it comes to mental health, especially what I've seen in my family, is that when the regular things break down, like the foundations that we have, like, the money issues, when the basic the food issues, the basic things break down, then if we don't have that strength, we kind of collapse. And it's almost like to the point we can't even do the basic minimal thing to stay alive. And so we have to focus on being strong, because if we can't focus on that, we'll just collapse under the weight and the pressure. I've definitely seen that in my family. I've experienced that myself. So I think that that's probably some of why we want to say we don't want to talk about it, we don't want to focus on it, because we really need to focus on just surviving.
Mm-hmm. And I was just thinking about this. I feel like for the Black community, taking thought for your mental health was a luxury, because we were so worried about surviving.
Mm-hmm.
And so now that a lot of us are in a position where, not where we were, in such survival mode, trying to understand that this is something that really needs to be addressed, and it's not a luxury. But I do think for a lot, even for some people still now, it's a luxury. Like, I don't got time to think about that.
Especially for the older generation, because that's what they know, that, and think about the times that they went through. Like you stated, Dr. Wooten, you had to be strong, because any sign of weakness, we were already dealing with so many different isms. So now, and then the stigma of like, oh, he's crazy, she's crazy. Nobody's going to open themselves up to that ridicule, that, that can be just something else, one more thing used against you to stop you from, going from surviving to thriving. So, so it's just something that we have to kind of keep pushing through. Younger generation, you can talk to them, you do what you can, but it's like we focus on, because geriatric mental health is really not a thing. Nobody really talks about it as much as they should. But when you get like to middle age and younger, that's where we got to really try to make some headway and make it not a stigma. So you have to make it attractive. You have to make mental health like, we eat, we take care of our bodies. You want to be that athlete, you got to do the same for your mind, and we can go from surviving to thriving.
And while we're on that point, what does mental health mean to you?
What does it mean to me is being in, like I said earlier, a safe and positive and healthy space emotionally and mentally. And that means protecting your space with boundaries, knowing who you are, making sure you have your village around you. We all have to have a village. I don't care who you are. You got to have those aunties, those uncles, whoever it is. Sometimes it's not family, and that's okay too. But it's someone that's going to treat you with kindness and goodness, and know that you deserve everything good and positive just because you're human. And do it authentically, organically. It's not something you have to work for or fight for to be respected and have that sense of loyalty and uplifting for you. So that's what it means to me, because like you said, with my family, friends, coworkers, I've seen it. I deal with mental health very differently. I just kind of pull back and get quiet and listen to music. Like, you got to have your self-care. Like, I listen to my music. I listen to, watch the Golden Girls and eat ice cream. No, I really, 15 minutes. I listen to Tupac. Like, there's certain things, the speed limit is like, I hope I don't get in trouble with this, but the speed limit is like 55 on the expressway. I'll do 60 and listen to Tupac. And I'm right as rain, because I feel like I'm doing something naughty. I'm like, oh my God. And I'm right as rain, but it's like, I need that time. Or, and then if that's not enough, then that's when we need to kind of, because we have those tools inside of us. Sometimes life and people and things make us think that we do not, but we have everything. God gave us everything we needed. It's inside of us, right? But if that's not enough, then that's when you reach out to your church family, your actual family, your community, because connection is what heals trauma and pain. If we're connected to each other, if we're talking to each other, and we need to look out for each other. Like I said, how I said earlier about the church and the pastor and the congregants, or, whoever the faith leader is. If you're in your community or you're in your family and somebody that was once really bubbly talking and things like that, and you see changes in their behavior, those are red flags. Don't let that go by. Don't. So many people be like, "Oh, how you doing?" And they keep walking or they keep going. No, stop and really look at this person. What's going on? What's up? So yeah.
What do you think, Dr. Wooten? What does mental health mean to you?
Oh, I think that's a deep question, because for many years and most of my life, I never really focused on it. I thought that focusing on mental health was a first world problem, and I didn't have time for first world problems at the time. But I do think it's really focusing and cultivating like the parts of you. So outside of, spiritual and physical, it's a lot of the emotional focus, and how, for me, I felt like how I dealt with conflict, how I dealt with work, how I deal with the external forces that I can't control. And I think that's why for many people it's very hard, because that's how I define mental health. And it's something that is kind of outside of what I feel like I can control, other than my response to, said event or said, stimulus. And for me, that was a hard thing, because I did feel like I wasn't allowed to express myself. So I think for me, that's a harder question to answer, just because it's not one particular thing. It's a lot of the environment that I've been in. But that's how I would describe it.
What do you think, Dr. Neal?
So for me, mental health is honoring yourself enough to take the time that you need to renew. So for you talked about driving. My thing is, I'll run a bath, I'll fill it up, I'll sit, sometimes listen to music, sometimes I'll stay in for 5 minutes, sometimes for 25 minutes. That's kind of what I do at the end of the day. Also, I think it's, taking the time to make a nice meal for yourself. And take yourself out to dinner. I will, if I don't have someone to go, I will take myself out to dinner, have a glass of wine. So I think it's giving yourself the time and space to be able to just renew and sit quietly and think about your feelings and say, well, how did you feel today? How, ask yourself those questions that we normally don't, because when you stop and you take some time, I think that's when you can kind of renew and kind of maybe sort out those things that may be challenges in your life or things like that. So that's what mental health to me is. Honoring yourself enough to take the time to think about you and only you, which as a Black woman, I mean, we weren't raised to do that. You know what I mean? It was
Not at all.
No, you think about your family. So how we talked about luxury. But I think when you do that, you actually are a better mom. Like when I took that time, I was a better mom. I was a better, partner or whatever. So better doctor, in fact. So yeah,
absolutely. So yeah, I loved both of your answers, because I think your answers combine what for me is what mental health is.
Okay.
Controlling things you can't, you just can't. Like, we are doctors, we deal with patients. I'm not joking. Sometimes I just have to go in the bathroom and just be like, woosah. Sometimes I literally, then I come back out, and then but I need a moment. Sometimes I need to, again, you can't control what people do, but you can control your response. And then I have learned in the almost 15 years that I've been practicing that even though I may not be able to control a patient's response, I control how I respond to them and what I'm going to tolerate and what I'm not going to do.
Right.
Because I say that to people, like, so what we're not going to do is this, because that's not what we're doing. I don't know what to tell you.
So it's almost like having the space and grace to fall in love with yourself, put boundaries and expectations, and but expect the same for others to do that for themselves.
Yes,
so we're all
absolutely.
like loving and respecting ourselves, and that's the expectation. If everybody could do that, we would have such a nicer world.
Such a nicer world. I mean, you listen to Tupac, you take a bath. I like to work out, and I like to work out hard, like to the point where I'm just like, because it just helps me to get that aggression out. I like to. It does. I'm telling you.
What kind of patient she is?
I know.
You don't know.
That's
I'm like, what?
These patients. I love my patients. Please believe and trust. And I feel like I give my all to my patients.
yeah, and that's hard.
And I do. And that's one reason why I work 3 days a week. Just FYI.
Very nice.
3 days a
3
week.
days.
Because I will give you my all those 3 days. But when I'm not at work, I don't tell you.
You have to unplug.
I do. I completely unplug. And then sometimes when you give all that to them, and then the response back is just like, did you hear anything that I said? And so then sometimes you just have to like, okay, you know, it is what it is. But I think that, you know, even another kind of way to segue into, you know, the strong Black woman, right? And so, you know, before that used to be my, you know, be the strong Black woman. Now I'm like, I don't want to. I'm not going to. I don't need to be. And learning when to say no.
Learning when that's where those boundaries come into play.
Yes.
And we don't have to hold everybody, because when do we get held?
Right.
Right. And sometimes our partners are not in the space of grace. You know, we're talking about women, but for men and African American men in mental health, I mean, it's just now starting to get some just even some talk or some recognition around it. But I mean, they're struggling as well. So it's like, if I have to hold everything down, and it's not just, you know, the daily routine, it's the mental and emotional of my whole family, making sure everybody feels, you know, safe and they're good and don't have teenagers and they're going through their thing. And then and most of us are in a sandwich generation where we're taking care of, you know, I know we are right now, we're taking care of parents, raising kids, we're working. Maybe we're going to school. Maybe we want to do something for ourselves, but you can't, because if you breathe, if you go out of the line 1 inch, everything falls. That's a heavy burden, and that's a lot. And it's a lot of what you just said. There's a lot of it you can't control because you're dealing with other human beings.
Right.
When you're dealing with other human beings, only thing you can control is your response, right? And I always tell people, don't be reactive. Take 7 seconds. Think about your response. And if you don't want it to be, if you don't want to respond, just say, you know, I'm going to table that. We're going to circle back to that. Or I'm going to come back to that. You don't have to do anything. But what you do owe yourself is to respond in a way that you can walk away with dignity and respect. And that's not going to change the trajectory of anything, your relationship with your partner, with your kids, with your patients. You know, I have psychiatric patients, and it gets real interesting at times. And I have no problem telling the patient, I am not going to medicate your environment. Let's get your house in order.
Yeah, okay.
And when you say it with, and especially if they're seeing somebody that looks like them, and then you say it with empathy, and they understand you and they trust you, everything, usually 9 times out of 10, and I'm knocking on wood, I don't know if this wood, but because, you know, might change after this, but usually have really good success. But you have to get very real. But it's like, it's because I'm solid with me, right? And experiences, and sometimes our patients can trigger us because we have maybe dealing with something.
Yep.
And we don't even realize it. And they may do or say something that take us somewhere we don't even realize. The body keeps the score. There's a really good book called The Body Keeps the Score of all the traumas and dramas and things that we don't even realize sometimes because we've compartmentalized. You know, and that's the brain's way of protecting itself. So that's why it's like we really have to just check how we express our response, if you will, to when somebody does trigger us. And so that's why I always take a 7-second rule, or I'll sleep on it, or I'll do my Tupac, or I do my Golden Girls, and then I'll come back to it, you know, or sleep on it. But I definitely have to address it. And then you put those boundaries, fall in love with yourself, and give yourself the space and grace. I love that you said that. You give yourself the space and grace that you want to give to somebody else.
So just to pivot a little bit, so the Black community, the medical community and Black pain.
Ooh. Yes.
What are your thoughts about that?
Okay, are we talking physical, mental, both?
I want to start with physical.
Okay.
I want to start with physical, and then we can go to mental, because we have heard numerous stories, even with, you know, Black women who have had children, and then they've had pain or they've had some kind of issue, and it wasn't addressed, and then they died because nobody listened to their pain, or you know, a lot of other issues that they're suffering in true pain, but nobody's actually listening to what they have to say. Now, to be fair, in my opinion, sometimes the way some of our people can come off, if you don't know how to, that's why I think culturally it's important to go to doctors who look like you, because sometimes we are able to, you know, kind of mitigate and actually listen. But sometimes, you know, I have a great story. So this is crazy and funny to me at the same time. I had a friend who had she was a nurse, a Black nurse. She had a patient who, you know, shift change. Right. So the first nurse was not of color, and she put in the chart that this patient needed a psych eval because every time she went in the room, the patient was hitting herself in the head.
Because of her weave.
See, of course.
Yes. Yeah, we know.
Yeah. We know. But they actually put that in her chart, that she needed a psych eval because she had braids, she had weave, her head itched. But they didn't understand that, and things like we understand. I mean, can you imagine somebody putting that in your chart, and you're like,
and that's in your chart forever.
And you know how sometimes, you know, Black women can pop off. I just had a baby. Why are you in here?
Right.
Well, you were hitting your head. Like,
what?
And
my hormones are racing.
Right.
And
so then you get angry. Then you get the Black angry woman. So like things can just spike out of control.
Right.
Because of lack of understanding. So I guess my question is, how do we get Black, you know, our community to understand when you do have pain, how to advocate for yourself? I don't know.
So that's where the health literacy come into play. Like we have to know our rights. There's a patient bill of rights for a reason. We have to know our rights. We have to, I think we should take advocates to the hospital with us. You know, if you know somebody in the medical field, you know, call them and have them meet you at the hospital or something. But we have to have some knowledge of how to engage the medical community. But the medical community also has to know how to engage us. Even if they're not a person of color, they can have cultural humility. They can learn it. If you're working in these communities, you need to know who you're serving, right? You know, Nike can't, you know, like the NBA, they can't go and like try to recruit people that play football, right? You got to know your audience and how to, you know, play to your audience so you can get the best result from them. So why didn't she just ask what's going on? That's a simple question.
Simple question.
Is everything okay? What's going on? You know what I mean? Yeah. Easy. Oh, my weave. Oh, okay. Then you wouldn't have to write that. But did this person not think this person was human enough to ask?
Yeah.
Because I would have asked. I asked the craziest questions. What's going on? Because I want to know what's going on with you. Now I'm just going to assume.
Right.
But that's where that cultural humility and just knowing what is going on with another culture, especially if you're serving them, you know, you just can't assume. And so, so be an advocate, get some health literacy, and know your rights. And if you are not getting what you want, understand at the end of the day, your insurance is paying. Like, we go to school, we did all this, but at the end of the day, the patient is, that's how I look at it. The patient is the customer. The patient is the reason why I'm here. Because without patients, doors would close. Without insurance, or if they're paying cash, however it's being paid, bills would not get paid. So we have to understand that, yes, we are the experts because we did go to school, we did sit for boards, all this other stuff. But we also have to, they're the experts on their body. They're the experts on their experience. And so we have to honor that as well. So, yeah, I could talk all day about this because it really burns me up because I've seen that. I've worked with sickle cell patients. Well, they won't give them pain medicine. They think they're drug seeking. And I'm like, are you kidding me?
Right.
They're in a crisis right now. Oh, no, they don't need morphine. Yes, they do. So now I got to go over your head and, you know, cause a problem and, do what we got to do because you don't want to prescribe it. This is when I was an RN. It was like, no, this patient is getting their medicine. And even if they are drug seeking, they're getting their medicine. They're in crisis right now. But you're right. They don't, our pain is not addressed. And so when it comes to the mental, definitely, because it's already stigmatized. So we're already stigmatized to not even want to seek it out. So we may be responsive in a sense of, you get pulled over by the police, or somebody says something to you, and you might be in postpartum depression, right? Or baby blues, postpartum depression, or you just might have had a bad day, and I love when you said we pop off. We do. But everybody does, right?
Yes,
so,
absolutely.
But why are some other people given space and grace and others not? But other people will interpret it a certain way, right? And so we're not given the same space and grace to be in mental pain or anguish, or I just saw my kid get hurt and I'm on my knees screaming. It's like, oh, something's wrong with her. No, because you would be doing the same. Maybe you don't express it the same, but that doesn't mean it's any less painful. And so that's where that cultural competence and humility, all those things come into play, even if you are not a person of color. Because even if you're a person of color, sometimes, okay, they're not given the same that you would think should be given. So we just have to have some humility and understand that everybody's human. Everybody deserves everything that's good and positive just because they're here. And sometimes we do have to check ourselves. As a provider, as a patient, they have to understand that the provider is a person too. We're all dealing with stuff where, just because we have this, the white coat doesn't mean that we don't have stuff going on too. A lot of times we do, just like you had stated, medical school and everything that can go to it. When I went through the nurse practitioner program at Duville's amazing. If they see this, Duville's an amazing university. I was like, is this an experiment? They're trying to make we're all like nurses, RNs. We ran hospitals, all this stuff. And we decided to go back to school. And I'm like, is this an experiment to see if we could be patients? Because I'm like, there were times I'm like, what is going on? And so just probably got a little iota of what you guys go through in medical school. But it's just like, we're all going through something, every single one of us.
So clearly we've had great conversation. Yes. And clearly this is something that I think needs a part 2.
Yes.
Yeah.
I really do.
Yes.
So just to kind of, give some advice. So what advice would you give to someone who's afraid to seek help, and give us some accessible tools or resources?
Okay. So if we're afraid to seek help, I have to give you kudos that you recognize that you do need help. Right, we have to give people their props that you recognize that something is not right. I'm hearing voices, or maybe I'm having some psychosomatic things going on. I'm really anxious, and so I'm itchy all over, like something's going on. But there are some resources that people can utilize that are even anonymous. There's, you can go online and get counseling, and because some people are just scared. They don't want to be seen. They don't want to, maybe they're prominent in the community. I don't know, but you can use 988. Which is like 911 is when you're having like a physical emergency or a safety concern. 988 is for mental health crises, or if you're suicidal. And it's directly linked to crisis services here in Buffalo, which that number is 716-834-3131 as well. So that is good. You will get somebody on the line. They will talk you down. If it needs the next level, like you need to be admitted or need to be seen, they have crisis mobile units. There's so much that can be done. Talk to somebody. Reach out, whether, if that's not a avenue people are comfortable with, talk to somebody that you trust, whether it's, school, work, church, community. It could be a neighbor, family. I could say talk to yourself, but take that to the next level and find somebody else. Because sometimes we can self-soothe, right? But if that's not working, talk to somebody that we trust. And then if that isn't working, you need to find a professional to talk to, because there's no shame in getting therapy. Then there's all, talk therapy, there's cognitive behavioral therapy, there's DBT, there's EMDR, all these different therapies, but there's nothing wrong with medication and therapy together. Like I said, if I have a strained muscle, I'm going to go and get my physical therapy, and I'm going to take that Motrin or whatever, that pain, Lortab to go with it. It's no different.
Right.
No different. It's been stigmatized, and I feel like it's been used against us, because, like I said, the real game is what's up here. It really isn't, those football players, basketball players, and I love me some football, go Bills, love me from football. But if they don't have it up here, this is where the real game is. The body, the body's going to do what this body's going to do. There's a formula. You eat right, you exercise, you do all the different variations of the repetitions of all that. You're going to go somewhere. But if somebody can get in your head and make you think that you're not good enough, then you're not confident, you're imposter syndrome. I know we all have experienced that, or all these different things, then the game is already lost. So we have mentally and emotionally, we got to take care of up there.
Well, thank you so much.
Thanks for having me. I love this topic.
For coming.
Love it.
That brings us to the end of this episode of Healing with Her. We hope that you found the information enlightening, empowering. Please find our link on our Instagram, Healing with Her podcast. And we also want you to remember that seeking help is strength and not shame. Yes. Healing is possible, and you are not alone. So on our next episode of Healing with Her, we are going to have a pharmacist, and it's going to be called Ask Me, Dr. Lee. And he's going to give us some information on prescription drugs and how to deal with different things with your pharmacy. A lot of great advice. Again, our disclaimer must happen. This information shared on Healing with Her is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified healthcare providers with any questions you may have regarding your health. The views expressed by the host and guests are their own and do not necessarily reflect those of their institutions or employers. Until next time, thank you for joining us.
Thank you.
Bye.